there are examples of small physician practices working through IPAs that are every bit as effective as being in large group practices. That doesn't mean that large group practices are bad. It doesn't mean that IPAs are better. I think that there is a choice, but that physicians do not necessarily need to give up their independence as small independent practices to be able to participate in these models. If we want to think about flexibility and competition, I think that the IPA model actually provides more opportunity than everybody joining one big organization. But I think those are choices for physicians to make. I think that one of the bigger challenges is that if you work for a hospital system, what is the fundamental motivation of that? And if you look around the country, you can see big integrated systems, you know, and some are physician-led and some are not. My somewhat facetious characterization of the big integrated systems around the country is that in some cases they are really hospitals that view physicians as a necessary evil, and in some cases they are physicians that view hospitals as a necessary evil. And what we want to be able to move to, frankly, I think, if we're going to be able to actually control the cost of care, is to have physicians in the lead and who basically view, you know, hospitalization as something to be avoided, not something to be promoted.